morning, everyone. My name's Erin O'Brien.
Hey guys, I hope you're all doing well. My name is Jade Collins.
Hi, my name is Anjali Salunke.
Today, we are going to be proposing to implement the first North Carolina University's fully functional mobile clinic, ECU AID. AID stands for Accessible, Inclusive, Dental Equality. We are so excited to share all the benefits this would have on our campus and community with you all. Hope you guys enjoy our presentation.
The following video is a quick overview of what our clinic would entail.
This might tickle.
For the last 10 years, access to oral health care has been the number one unmet health need in the state of Ohio. Vulnerable populations in particular, that would be our children and our low-income adults, still have difficulty accessing care.
Now bite. Just like that. Bite really hard. Awesome. Don't move. Good job.
One thing that we are extremely proud of is the fact that we have digital, portable, handheld x-ray. So that will increase our efficiency when it comes to our diagnostic capabilities. So we're very excited about that.
We're almost there. We're going to count to 20, okay? And then we'll be done with that too. Here we go.
The number of procedures that we do. We obviously do the preventive work. We're doing sealants on teeth, but we're filling teeth, we're pulling teeth, we do stainless steel crowns. It's amazing the procedures that we're able to accomplish on the bus. At Ohio State, so we're learning orthodontics and we're learning periodontics, we're learning endo, we're learning all these different things. At pedo, I feel like we get just a taste of it. The great thing about this is we get a population of kids that we may never come into contact with. Some of us, at school, and when we get out of here, some of us won't deal with children. So it's invaluable, in my opinion, to be able to learn how to deal with a unique population. Children are not adults. They come in with their own different fears and their ideas of what dentistry is and isn't, and we're able to mold that before they, get these feelings about I hate the dentist or whatever. We can give them a positive view of what a dentist does and, how to take care of our teeth, and so it's good.
As you can see, the mobile unit does not only provide dental screenings and procedures, but is also an opportunity for education and health promotion. We'll go further into detail later in our presentation. ECU's mission is to be a university that is a national model for student success, public service, and regional transformation through the means of innovative strategies transforming healthcare and improving quality of life. Our primary goals are to achieve that notion of national recognition by modeling student success by developing leaders to create changes related to reducing health disparities. These goals kind of go hand in hand with improving students' self-efficacy and teamwork skills, which would allow them to become more marketable to future employers. Okay, so you might be wondering what this mobile clinic is. AID stands for Accessible, Inclusive Dental Equality. This new state-of-the-art mobile dental clinic will be structured from a repurposed ECU transit bus that'll be donated to us. It'll be used to provide dental screenings to ECU students and faculty, and will provide accessible, free dental screenings and procedures to students and staff in central locations on campus so that they're easily accessible by everyone. An issue with getting oral health treatment in North Carolina is that they just aren't accessible to everyone. Those who are middle or low income may not be able to afford going to standard dental services and getting those treatments for them. According to data by the American Dental Association, many states lack neutral free dental clinics that are available to everyone. It will also serve as a outlet to enhance education and overall experience at various organizational levels. So at the university level, campus departments and organizations like dental students from ECU School of Dental Medicine and the College of Engineering and Technology will positively benefit from the pilot program, and eventually, after we've successfully completed the pilot program, surrounding communities in the Pitt County area and North Carolina and the United States as a whole will also achieve positive benefits from the program.
So some things that we're going to need for our idealized outcome to be possible are old ECU transit buses. We're going to be using these buses to hold our clinics so that we can have more patients come in because we have more space. We think that the size of these buses are going to be a great asset for our clinic because compared to other clinics that use small vans or larger vehicles, they can only see up to 4 patients at a time. With our ECU transit buses, we'll be able to see way more than 4 patients at a time, and we'll be able to have people come in and out of our clinics easily. The flow will be nice, everything will go at a smooth pace, and we'll even have more room for all the dental equipment that we need. So something else that we need for our idealized outcomes to be possible are extensive knowledge from 3 different colleges across ECU's campus. The first one that we're going to be focusing on is ECU's Dental School of Medicine. We're going to be having these students log their hours that they need for their program to be able to do cleanings for our patients and screenings and anything else that they might need while coming to our clinic. Something else that we are looking forward to having helping us is the College of Marketing. If we don't have the College of Marketing on our side, we're not going to be able to broadcast our clinic how we want to. We're going to be able to utilize these students and their skills and their knowledge to be able to reach people that we could never think of reaching through social media, television advertisements, anything you can think of, we're going to partner with them for. Another college that we are trying to connect with is the construction management students. We're going to try to get with them because we need our buses to be functional for a lot of people to be on. So in order for our buses to have a lot of people on comfortably while seeing dentists, we're going to need chairs taken out of the buses, we're going to need shelves put in for all the equipment. So we're going to need these students to be able to do that for us. Another thing that we're going to need for our clinic to run is all of the equipment. So hopefully we can partner with local dentist offices around Pitt County to see if we can have them partner with us or have them fund different equipment for us. Anything that they can do to help us run our clinic, we'll be very appreciative of.
Okay, so how does ECU in general benefit from the program? There are multiple departments and academic programs that could expand and grow because of the creation of ECU Aid. Individuals from these departments are encouraged to collaborate with one another in order to succeed in putting together the program. For example, dental students who will take lead on the program have an opportunity to practice their skills and knowledge that they've learned in the classroom and clinical settings in a new setting. This also gives them the chance to educate others on oral and dental healthcare and possibly even open up career interests to future generations. The College of Engineering and Technology plays a really, really large role as well. Both the construction management and engineering students will be really hands-on at the beginning of the program during our primary stages, because they'll be assisting in testing and creating the plumbing that runs through the bus to equip the dental sinks in the buses. With normal jobs after college, students from both degree programs are expected to work together in order to successfully engineer a building or an object, but they might not ever have the opportunity to get that hands-on real-life experience that we're able to provide. Another really big portion of the program is ensuring that we're able to get the word out about our program so that we have participants. We can do this by creating flyers or billboards or posters, or even just making a website that displays all of our information and when or where our mobile unit will be located at a given time. We'll be bringing in marketing students to help us design these items so that they're not only appealing but also really informative but not overwhelming to the general public. Another group that would be interested is pre-dental students. Most of these students are part of an organization like the Pre-Dental Honor Society. Because of their interest in attending dental school, they'll definitely benefit from being involved in the operation of the mobile unit. While they can't really physically perform anything on the patients, they can help in the administration of the program. This might be checking in patients at the beginning when they arrive at the unit, or making sure that they're ready to go at the end of their screening or their procedure. It might allow them to get experience in a clinical setting as well, or just give them volunteer hours for the Honor Society. As we continue to expand our program to outside of ECU students and faculty, these pre-dental students could teach proper brushing and flossing techniques to children that the unit is serving. Similar to the video that we showed at the beginning of class, we will provide dental models and materials to demonstrate these skills. It's really important that when we expand our population, we target kids as well, because according to data from the World Health Organization, though there are more than 3.5 billion cases of oral and dental disease in the world, more than 600 to 700 of these are located in just children. By bringing together all of these groups, we're able to provide resources outside of just the classroom setting for students to practice and test their skills. This will definitely improve students' self-efficacy on the techniques and information that they've learned in the classroom from their degree programs, and it'll also provide them with real experience to make them more marketable to future employers. It'll also provide a resource for faculty and staff so that they're able to build on in-class techniques by utilizing hands-on experience and procedures. A lot of students complain that they'll never really use certain information outside of the classroom, but this gives them the opportunity to really put all that information that they've learned into a concrete result. Also, having to work with multiple different people, organizations, and leaders will improve their collaboration and teamwork skills that are necessary in any part of your life. And again, obtaining these skills will continue to make students more marketable in the future. Lastly, ECU will be nationally recognized for projecting knowledge, skills, and values taught here at our university into public service opportunities. This not only fulfills the mission of becoming recognized for public service, but also student success, because these students are able to take the skills taught in class and use them in a different setting. This just shows that students are successfully able to demonstrate their knowledge to a certain extent. And lastly, of course, we would be recognized for our improvement of standard for oral health care, because we would be providing dental screenings and certain procedures, and also educating students and staff about proper hygienic oral health care.
So now that we've taken a little bit of time to talk about how ECU benefits from our program as a whole, I want to take a step further and talk about how students benefit from this program. Students that are part of ECU's Dental School of Medicine are really going to strive with this program. Having the opportunity to do service learning hours or volunteer hours that they may need that's required for their program, being able to get those done and getting hands-on experience is going to be one of the best things that they can do for themselves. I think that another thing that is going to be very beneficial for students is that coming to our clinics and volunteering with us, they're going to be able to achieve and get down all of those basic skills that they need for everyday tasks that they're going to have as a dentist or a hygienist or anything in the oral health field. I think that it's going to be great for students that want to gain self-efficacy in terms of applying skills that they learn in the classroom and putting them into hands-on scenarios that they are going to be facing when helping our clinic out.
Some of the benefits to mobile health clinics are promoting oral health education and awareness. This advocates for health to everyone in society, and in turn it increases health literacy. And another benefit is the increased accessibility, that mobile clinics can move and you can go anywhere within the community that you need to if you were going to have an event or anything. And then comprehensive oral care can be achieved right on ECU's campus now, so super easy, no one has an excuse anymore, and this is a huge benefit for underserved populations. The next benefit is cost-saving benefits, and that just has to do with reducing emergency dental visits and in turn reducing the amount of money we're spent on that's spent on emergency visits in the hospitals. Not cheap. And then it also removes logistical barriers to care. Some people can't go to work just because they have to work, or some people can't go to the doctor just because they have to work all day. So thinking about stuff like that, now preventative care treatments are available right in their neighborhood or right at their work site, so that makes it easy for them to access that care. And then the people on the mobile health clinics actually work with developing patient-centric approach, which this means they're developing that one-on-one connection and increasing the trust and self-efficacy of that patient in the healthcare system.
So now that we've told you guys about our program and how we plan to benefit the community of Pitt County, how are we going to know that it's going to work? So while we have our clinic going for a year, we are going to be taking mandatory attendance of everyone that comes through the doors of our transit buses, whether it be students that are getting their participation hours or just members of the community that need dental assistance. We're going to be tracking everything. If we see that there's a spike of the number of people that come to our clinic from the beginning to the end, then after our 1-year study, we are going to expand to other areas around Pitt County, such as Tarboro, Kinston, Bertie, and Washington, and we are going to try to get transit buses out to those places to help reach people that need more dental assistance. Here's a quick video for y'all to watch so we can show you what our idea is to make the inside of our old ECU school buses completely new and refurbished.
Combines 2 trailers in one. That's for especially in in what we do. It's got state-of-the-art chairs. These are ADEC chairs, which are the leading manufacturers of dental chairs, and it's right up there. And it's got a space for sterilization, and it's wired for connectivity for all computer equipment. It's got 3 TVs on each side. This is our X-ray room with lead-protected walls to prevent radiation, and it has its own X-ray chair in that. So we kind of made it cute for kids. We mixed and matched the colors, so it gives a little bit more lively appearance. And what I also want to stress is the superior quality of materials, which makes it cleaning the interiors much easier and makes it cleaner. It's more resistant to microorganisms, the type of material used. And it's 8 custom-made cabinets, which Eki and Edwin helped design. So these are catered so that we can do chairside storage much easier. Besides being a mobile clinic fleet, it can use a standalone clinic and do it for occasions where I don't have to take everything along. Literally, I have to take one trailer, which is self-sufficient in all shapes and forms.
Since we have shared numerous benefits that AID would bring East Carolina University, I want to talk a little bit more about what kind of impact mobile clinics are having within the U.S. In this scholarly article published within the International Journal for Health Equity, The Scope and Impact of Mobile Health Clinics in the United States, we get to learn about the most commonly identified themes that make mobile health clinics so beneficial for society. Some of the positive impacts of these mobile health clinics in the United States is their increasing healthcare access to individuals. Clinics do this by reducing barriers. Some of the common health barriers across the globe are transportation, insurance status, lack of providers, financial costs, psychological barriers, and hours of operations. The second impact of mobile health clinics is improving health outcomes, and they can do this by initiating preventative screenings and enabling self-efficacy in patients. The use of mobile clinics also help address social determinants, which affect the ability of an individual to develop a healthy lifestyle and ultimately control their health status. The most vulnerable members of the population are the economically disadvantaged. To advance population health, preventative screenings and disease management through the mobile health clinics improve the detection of chronic disease and infectious illness. This is especially true when working with vulnerable populations who are unable to access healthcare somewhere else. And then reducing healthcare costs by avoiding emergency room visits,